everyone. Katie Starantino, the Director of Wellness Initiatives. So before we get going, let me introduce our speaker today. And first, I'd like to shout out one of our care coordinators who came up with the idea for this webinar. So please talk with your care coordinators about anything that you may be experiencing that you'd like to see and get some help with. So I would like to introduce our speaker now, and her name is Dr. Michelle Friedman. She is the owner of Atlantic Physical Therapy. She graduated from Drexel University's Doctor of Physical Therapy program in 2007 with a concentration in orthopedics, and she holds a Bachelor of Science degree from the George Washington University. She founded Atlantic Physical Therapy in 2015 with a mission to provide high-quality holistic care. She has experience in inpatient settings, outpatient settings, and clinical instruction. She holds certifications in the Graston technique, the aligned flow yoga method, and a CAP certification in pelvic floor therapy through the Women's Health section of the American Physical Therapy Association. She's interested in integrating a holistic approach to rehabilitating her patients, which includes yoga, dietary, and lifestyle changes. Thank you for being with us today, Dr. Michelle.
Thank you so much for that wonderful introduction, Katie. I'm so happy to be here today to talk about my passion, which is pelvic floor physical therapy and pelvic health in general. A little bit more about myself. I've been a physical therapist now for 17 years. I started out in orthopedics, which means just muscle, bone, joint injuries. And I spent the first 10 years of my career working in orthopedics, treating people's backs and hips and knees mostly. When I bought my practice in 2015, I shifted over to pelvic health because a lot of my friends started having babies and needing pelvic floor physical therapy. So I became interested in that subject and started taking continuing education classes. And now it's the largest section of what I do. It's probably 90% of the patients I treat now are pelvic health patients. I work a lot with folks who experience incontinence and pelvic pain and pain with sex. And it's truly life changing what pelvic floor physical therapy can do. So I'm so happy to be able to share my passion with everyone here today, if you can see me. So we're going to go over what the pelvic floor is and how we can optimize its function today. And then we're going to be doing a lot of movement and exercise today. So I hope you're wearing comfortable clothes. If not, there's some time to change into something comfortable that you can move in. We're going to do things with low or no equipment today, so not really much else you need. And most of our exercises today can be done in a chair or lying in bed or lying on a yoga mat. So we should be all right. All right, so I'm going to start by sharing my screen to my guide to pelvic floor health. So let's start by talking about what a pelvic floor is. And the easiest way to say what that is, it's a group of muscles that is located at the base of your pelvis. So right here, and they kind of look like a sling when they work together. It's a bunch of different muscles, but in general, they all work together to support your most important organs. So your bladder, your uterus, your rectum, and those sit at the base of your pelvis. So when those muscles are activated, that hammock lifts. When those muscles relax, that hammock drops. When these muscles are strong and working properly, you have better control of your bowel, your bladder, your sexual function. If they're weak or not functioning properly, it can lead to problems like urinary or fecal incontinence or pelvic organ prolapse, which is a fancy way of saying your organs push into places they don't belong. All right. So the pelvic floor functions in three different ways. One is what we just talked about. It supports your internal organs. All of our organs are suspended by ligaments. And when there's damage to those ligaments or those ligaments are stretched out, there's not much that could be done to the ligaments. But our muscles are a secondary support system, so that we can control our function over. So we can strengthen those muscles. Um, so it helps keep those organs in place where ligaments over time tend to stretch and relax with gravity, with age, with childbirth. Um, Other thing it does is support sexual function. When those muscles are working properly, there's good blood flow to our sexual organs. So it's better erections, better ease of sexual function. If your pelvic floor muscles are working well, they should be able to relax too, which is important for intercourse. And the other function of the pelvic floor is stabilizing the core. Um, your core is all the muscles from here to here and all the way around. So it includes your abdominal muscles, your low back muscles, and the base of our core is our pelvic floor. So when the pelvic floor is activated, it helps strengthen your back as well and support your posture and give you good stability with lifting, um, and sitting and standing, anything where you're upright, your core is working. All right. So let's talk a little bit about who gets pelvic floor dysfunction. We know now with studies that 67.5% of all women experience some kind of pelvic floor dysfunction in their life, whether that's incontinence, both rectal or urinary incontinence, constipation, or pain are our biggest ones. Um, the older we get, the more likely that we can develop pelvic floor dysfunction and higher rates of vaginal delivery, so having more babies, also increases risk of pelvic floor dysfunction. But men oftentimes get pelvic floor dysfunction as well. Probably the biggest population we treat of men is folks who have had prostate surgeries, which can often lead to incontinence issues, um, and constipation in men as well. So it's everyone has a pelvic floor. It's not only a women thing, and everyone can get pelvic floor dysfunction. So it's important to keep our pelvic floors really strong and also flexible. Um, Exercise is the key to keeping our pelvic floor muscles strong and flexible. So that's why we're going to go over some exercises today. All right. So the one exercise that almost everyone has heard about are called Kegels. I also use the term pelvic floor contraction, Kegels or pelvic floor contractions. I use those terms interchangeably. When people find out I'm a pelvic floor PT, they say, you must teach Kegels all the time. And I do. That's often a starting off point for our pelvic floors. So that's an isolated contraction of our pelvic floor. So when we talk about that hammock of our pelvic floor, it's a lift of that hammock. So we're going to practice right now doing a proper Kegel. All right. So you can do this in any position. You can sit, you can stand. In the picture I have up here now, um, the person is sitting, but if you prefer lying down to do this, knock yourself out. You can do a Kegel in any position. So we are going to start by squeezing the same muscles you would use to stop the stream of urine. Um, or if you're about to pass gas, the same muscles you're going to use to stop the flow of gas. Not much else should be moving. We're not squeezing your butt cheeks together. So we're going to practice this now. So if I looked at you on camera, I probably couldn't tell if you're doing a Kegel or not. It's something you mostly can feel. One cheat I use as a pelvic floor PT to know if a patient's doing a Kegel properly without an internal exam is I palpate or touch their lower abdominal muscles, because your lower abdominal muscles tend to fire at the same time or co-contract with your pelvic floor muscles. So if you're not sure if you're doing them correctly, you can find your hip bones right here. Make sure you see me on camera. Tilt the camera down for a second. So you're going to find your hip bones right here and come in 2 inches and feel those muscles. Maybe cough for a second. And those muscles pop out into your fingers when you cough. So we're going to keep our hands on those muscles to make sure we're doing a Kegel properly. So we're going to take a deep breath in. Let those muscles relax. And then on the exhale, start to tighten those lower belly muscles and lift up through our pelvic floor. I like to imagine that I'm lifting the lowest part of my belly up away from the top of my thighs. And we're going to hold that for 5, 4, 3, 2, 1. Good. And relax and take a deep breath. I am wearing a special counter ring in case you were wondering what this big plastic ring is, so I can count repetitions for us. So we're going to do that 10 more times. All right. Take a deep breath in. Let everything go. Make a big belly. And then on the exhale, you're going to start to tighten your lower abdominals and lift up through your pelvic floor for 5, 4, 3, 2, 1. The same thing would be done if you're sitting. So if you're sitting and doing this, just like in that picture, you're gonna lift and lower the same way, and you can still palpate those same muscles at your lower abs. So hold that for 5, 4, 3, 2, 1. Inhale, relax. And then exhale to tighten and lift. You should be able to talk this entire time. Your low belly is firing and your pelvic floor. Good. And then relax. Big inhale to relax, let your belly go. And then on the exhale, tighten and lift. We're going to hold for 5, 4, 3, 2, 1. Inhale, relax, let everything go. You should feel an initial drop of your pelvic floor in those bones right between that you sit on. So that pelvic floor drops between your sitting muscles or sitting bones. I'm sorry. Inhale, relax. Exhale and tighten. You're drawing up and in away from the chair that you're sitting on. If you're sitting in the chair, hold that for another 3, 2, 1, and relax. Big inhale. Exhale to tighten. 5, 4, 3, 2, 1. Good. Inhale, relax. Exhale to tighten for another 5, 4, 3, 2, and 1. We got 3 left. Inhale, relax. Exhale to tighten for 5, 4, 3, 2, 1. Good. We got 2 more. Inhale, relax. Exhale, tighten. Good. And you might find we're still tightening, that as you get better at this exercise, you can hold it longer. So we're just tightening for 5 seconds. You can relax. Inhale. And then exhale, tightening for your next one. As you get better at this, you can hold this much longer. By the time I discharge a patient, I want them to be able to hold a Kegel for about 60 seconds or so. Good. Inhale, relax. Let's do one more. Exhale and tighten. Perfect. For 5, 4, 3, 2, 1. Good. And relax. Take a few breaths in and let everything go. Our main breathing muscle, which is our diaphragm, runs parallel to our pelvic floor. So it runs up here. So when we're taking big belly breaths and descending our diaphragm, it gives a natural stretch to our pelvic floor. So it's a nice way to reset after doing a lot of Kegels. It's just as important to be able to relax as it is to contract. We want our Kegel muscles to be nice and relaxed and flexible so we can poop properly, get everything out, so we can enjoy sex without pain, because oftentimes those muscles can be tight. So we need them to relax as much as possible. So think about breathing into those muscles. If you have any kind of constipation issues or painful sex issues, we want to relax those muscles and not Kegel, do the opposite of a Kegel, which is not, is breathing essentially. All right, so the Kegels are the starting off point of all pelvic floor exercises. Everything else we'll be doing, the Kegel is the base, and then the movement is on top of that. When we strengthen any of our butt and hip muscles, there's overflow to our pelvic floor or Kegel muscles. So anything that strengthens your butt is also going to be great for your pelvic floor. So keeping that in mind, we're going to do another exercise here. And this one is very, very functional. To sit to stand. And I'm just going to use the chair right behind me here. All right, we're going to start in the same way as we just did, with a nice inhale to relax. And then we're going to tighten our pelvic floor. So same first step as that last one. And then this time we're going to keep that pelvic floor tight as we stand up. Perfect. You're holding it. You're holding the low belly tight. Remember that cheat to know if you're firing your pelvic floor. You tighten. You check your ab muscles. Make sure they're hard. Good. And then we're going to relax our pelvic floor as we go to sit down. Perfect. We're going to do 2 sets of 10 of these. So we're going to inhale, relax. Exhale, tighten our pelvic floor and stand up. And then inhale, relax back down. Beginner, use your hands. More advanced, no hands. All right, I'm going to do the more advanced version. Inhale, relax. Exhale and tighten. Great. Inhale, relax. Exhale and tighten. Inhale, relax. Exhale and tighten. Good. We've done 5. Let's go. Inhale, relax. Exhale and tighten. And you can add a little extra butt squeeze to this too to help strengthen your butt. Inhale, relax. Exhale and tighten. We got 3 more of this first set. Inhale, relax. Exhale and tighten. Another way to modify this to make it a little harder is to use a lower chair, and conversely use a higher chair if it's too hard for you to do with no hands, or just use your hands for support. So we got 1 more. Perfect. And we're squeezing our pelvic floor, tightening. Inhale, relax, and sit back down. Exhale, stand back up. And we're done our first set. So between sets, I like to take about 10 seconds or so. And that I'm just breathing, doing that same relaxing breath into our pelvic floor. If you have any knee issues from doing that, use your hands a little bit more. Try to get your nose over your toes. So if I'm from the side, fall out of the way. To put less stress on your knees, you want to get your body as far forward as you can and then lift your butt. And that usually helps with knees. Same thing going back down. You want to sit your butt back as far as you can to take pressure off your knees. So let's do one more set of 10. Inhale, relax. Exhale, tighten our pelvic floor, stand back up. And I'm feeling my abs to make sure they're tight too. Inhale, relax. Exhale, tighten and stand. Inhale, relax. Exhale, tighten. And I like that. Really make a long breath on the way out. A lot of people tend to hold their breath when they're exercising. So I tend to teach breath coordination with exercising just to make sure you're always breathing. People have a tendency to and hold their breath as they go, which actually puts more pressure on your pelvic floor. So just make sure you're breathing nice and even. The exercise, it really helps to do the hardest part of the exercise while you're exhaling, and that way you can hold your breath. Or like what I'm doing now and having a full conversation while exercising is a good way to ensure that you're also not holding your breath either. So counting out loud, counting repetitions helps to decrease pressure on your pelvic floor, because if you're talking, you're breathing, and not strain your pelvic floor by holding your breath. And that was number 10. So far, so good. All right. So let's do another exercise. It's very similar, our next exercise, but a little bit harder because we are maintaining tension in our thighs for this next one. So we're going to do a squat, a mini squat. Mini means we're just not going down quite as far. But if you feel really good about squats and really strong in your legs, you can go down even farther. Or hold this one a little bit longer too is a good way to modify it. I usually have folks hold on to something when they first start squatting just for balance. I like to usually recommend like a kitchen counter because that's up a little bit higher, but you can also use the back of a chair, which I'll use here. I have my table right here. Just like with the sit to stands, a good way to modify a squat to put less pressure on your knees is to sit your butt back further. So I'm going to do it that same way. And we're also going to do the same breath pattern. So inhale as we go down, exhale as we stand back up. So we're going to start with big inhale. As we squat back, exhale, we're tightening our pelvic floor, tightening our butt, tightening our abs, and standing back up. Perfect. Inhale down. Exhale up. Every time we're exhaling, we're tightening. Inhale down. Exhale up. Tighten your pelvic floor. Feel that lift. Inhale down. Exhale up. Inhale to relax your pelvic floor as we descend. Exhale up. Inhale down. Exhale up. And I'm going to show you a deeper one. Inhale down. Exhale up. And you only go as deep as you can. Inhale down. Exhale up. As you get more comfortable, maybe you do no hands. Inhale down. Exhale up. And that was our first set. Good. Take a breather. We're just breathing, relaxing for about 10 seconds. And this one also, if you ever use weights at home, you can certainly add dumbbells to your hands to do this by your sides. You can also keep the dumbbells up near your shoulders for a front squat, or hold one dumbbell out in front of you for a goblet squat as this exercise gets harder. All right, let's do our second set of squats. Inhale down, exhale up. And we're tightening on exhale. Inhale down, and we're lifting through our Kegels, lifting through our pelvic floor, lifting through our belly. Inhale down, exhale up. Squats are probably my favorite exercise because they are so functional. Everyone needs to be able to get out of chairs as we get older, off the toilet seat as we get older, out of bed, and squats really help keep your legs, your hips, your back really strong as you do that as we age. So a squat is good for just about everyone. You might need to make modifications, like I say, so you can butt back more. If you're having some knee issues, knees should be about hip width distance apart when you do them, and also driving apart. So we got one more. Perfect. Another way to make those harder over time is just to hold it at the bottom with the pelvic floor contraction. So if you're like knocking out 20 squats like we just did and it feels like nothing at all, go ahead and start holding them for like 5 seconds at the bottom, or do an extra set, or add some weights, or do it without holding on. There's a lot of ways to progress an exercise. And you know you're ready to progress when you feel like you can do more and more without getting tired, without feeling fatigue in those thighs. All right. Let's move on. So we're going to move on to a lying down exercise. Like I said earlier, you can do this on the mat and the floor, like in the picture. You can even do this one in bed if you don't want to get on the floor. It doesn't really matter. In bed might be a little harder if your bed is kind of soft, but if you have like a pretty firm mattress, you should be okay. So I'm going to angle this so you can see me lying down on the treatment table, and come back to the picture. Just move this out of the way. And bridge is one of my favorite pelvic floor strengthening exercises because it's really good for bed mobility, and keeping your pelvic floor strong without any extra pressure on your knees. All right, so to set up for the bridge, we're just going to lie on our back with our knees bent. If you have trouble breathing flat on your back like this, you can also prop yourself up with pillows or more wedges. So we're going to start the same way like we did our last couple of exercises, by just taking a deep breath into our belly and letting our pelvic floor relax. And then on the exhale, we're going to start to tighten our pelvic floor, tighten our belly, tighten our butt, and lift our butt off the table. And we're maintaining that good pelvic floor contraction. So everything is kind of moving towards midline here. And then on the next inhale, you're going to come down and relax everything. Perfect. All right. Inhale, relax. Exhale and bridge. Inhale, come back down. Exhale, tighten everything and come back up. Inhale, come back down. Exhale and bridge. Inhale, come back down. Exhale and bridge. Most people hold their breath when they're bridging up. So we want to make sure we're Fully exhaling and tightening as we bridge up. It might seem counterintuitive. We inhale, come down. Exhale, bridge up. But it's a good way to keep from breath holding and do the exercise correctly. Our pelvic floor has a more efficient contraction when we do it on an exhale. Down. Exhale, come up. And if you ever get mixed up, you start again with an inhale while lying down. And that was our last set of 10. So inhale, come down. So we're going to take a 10-second break and just do a few breaths, let everything go. If you haven't done exercise in a while, it's common to feel some like Charlie horse type cramping up in the back of your hamstrings. If that happens, stretch out your legs, do some hamstring stretches. It's just usually a reaction to not moving those muscles in a while. So a good way to counteract that is to stay really well hydrated, drink a lot of water, eat potassium, like bananas and potatoes have a lot of potassium. All right, let's start our second set. Inhale, come down. Exhale, bridge up, squeeze your butt, squeeze your pelvic floor, squeeze your abs. Inhale, come down. Exhale, bridge up. Inhale, come down. Exhale, up. If you experience any back pain with this exercise, just don't go up as high. Make it a smaller bridge. Ideally, you want to get to the point where you're making a straight line between your shoulder, your hip, your knee. And you can work towards that. And keeping your belly nice and taut and tight while we bridge is a good way to help take some pressure off of our low back. We got 4 more after this. Inhale, come down. Exhale, come up. Inhale, come down. Exhale, come up. Inhale, come down. Exhale, come up. Last one. Inhale, come down. Exhale, come up. Perfect. Inhale, relax. Maybe do some side to side windshield wipers just to relax your back. Hope everyone's doing okay so far. Great. Looks like we have a lot of people on the call, so hopefully everyone is doing well. And if you came in late, just to remind you, I'll take some time for questions at the end. All right. Okay, we're going to do another exercise on the table over here behind me, or in bed, or on the floor on a yoga mat. All right, so point that camera back down. And we're going to do a side lying hip abduction raise. If you remember Jane Fonda in the 80s, she did a lot of these. They're one of my favorite exercises. So to set yourself up, you're going to lie on your side. You can either keep your head propped up like I do with your arm. You can lie down. That part doesn't really matter too much. You want your bottom leg bent for support, and then your top leg is going to be straight. And you want to roll yourself forward a little bit so your hips are stacked on top of each other. And then you want to take your top leg and drag it back a few inches. The motion is the same. We're not going to worry as much with this one about coordinating with our breath. And we don't want to lift too high on this one. So I'm going to show you, we're going to tighten your pelvic floor to start. So lower abs are tight, and you can do that same cheat and feel your lower belly firing. And we're gonna lift just about a foot off the table here. So pelvic floor stays tight the whole time as we lift and lower. And we're gonna do 2 sets of 10 on this side, and then we'll flip over. People's tendency here is to drag their foot forward. You want to make sure if you look down that you only see the tip of your toe and not your entire foot. That's how you know you're in the right position. Ideally, your shoulder, your hip, your knee, your ankle are in one straight line. And your foot is facing forward and not towards the ceiling. And you should feel it if you're doing it right in your side booty here. It's your glute medius. It should be harder than it looks. That's 10. I know my side booty is burning. You can even feel it sometimes all the way down your leg and your ankle too, because those muscles are working secondarily. So that was my first set, our first set. Take a little breather, relax your pelvic floor. We're going to do one more set on that side, and then we'll flip over and do the other side. All right, straighten that leg back out. Tighten your pelvic floor and lift and lower. I like to think about lifting with my heel first to kind of keep that alignment together. And you want to make sure you're not rolling backwards either. You can hold on to the edge of the bed if that makes you feel secure. No one's ever rolled off the table for me. So that's good. But as you get more tired, the tendency is to like turn that hip out or drag that foot forward. So you always want to check for your form here. We got 4 more. 3 more. Pelvic floor stays tight with this one. 2 more. And 1 more. Beautiful. Shake everything out. We're gonna flip over onto the other side and do the other side. And you might find that one side is weaker than the other. It's harder on one side. Very, very common with a lot of folks. So if you find that one side is weaker, maybe you do that side a little bit more to make up for it if you have any strength deficits. So we're going to do this side. Same thing, set ourselves up. Bottom knee is bent. Our hips are stacked. Our pelvic floor is tight. Our leg is a little bit behind us, and we're going to lift and lower with our foot flexed up, toes towards us, leading with our heel first. Perfect. Belly stays tight. And if you find you can't get through a whole set of 10 without fatiguing, then maybe you do a few less and just build up to 10. And same thing, to make this one a little bit harder, maybe do 3 sets of 12 or 3 sets of 15 instead of 2 sets of 10. In the clinic, sometimes we put an ankle weight on patients if they start to get really good at this exercise and can do a bunch. That's another way to make it harder if you have ankle weights, or even a resistance band around your legs would work to make this one harder. We got 2 more. Side booty should be burning a little bit. Perfect. And then rest. That was our first set. Bend my knees and take a few breaths. And set breaks in general should be 10 to 15 seconds long. You don't want to take too much time. The point of any exercise is to get to the point of fatigue of our muscles. When we fatigue our muscles, that's how our body knows to grow more muscle fibers. So if you're doing an exercise for years and years and it's pretty easy at this point, it's time to make that exercise more difficult by doing more repetitions or adding some weight to it. Let's start our second set. Good. We're going to do 10 here. Moving right along. Yeah. overloading our muscles is important to make strength gains. Keep that knee nice and straight. Keep that foot flexed. And keep your pelvic floor and your belly firing. You want to take about 2 to 3 seconds to do each repetition here. We got 2 left. Almost there. Last one. Good. Perfect. We're almost through everything. Doing great. Okay, next one we can do in a chair. It's to work our inner thighs a little bit more, but you can also do this one lying down with your knees bent, whatever is more comfortable for you. I'm going to sit in the chair. I'm using a Pilates ball for this next exercise. You can use a pillow folded in half, a yoga block. You can even use your hands between your knees for this next exercise. So don't feel like you need to run out and get a Pilates ball, like a pillow right between your knees. Does the same thing. All right. So what we're going to do is a seated isometric hip adduction exercise. Adduction is the motion of moving our knees together. So we're going to start with an inhale. Let our belly go. And then the exhale, we're going to draw up and in our pelvic floor. And then we're also going to squeeze the ball like we're going to pop it. Good. We're going to hold that for a few seconds and then release on our inhale. Exhale, belly squeezes in, thighs squeeze together. You want to make sure you're nice and upright here if you're doing this seated. Inhale, release. Exhale, tighten and hold. I wrote a note on here. Make sure you're not holding your breath every time you do this. Make sure you can count or have a conversation. Inhale, release. Exhale and tighten and hold. Perfect. This is a really good exercise too, in addition to strengthening your pelvic floor, to help with low back pain. Especially if you have any pain down in your SI joints, the lowest part of our low back, where our back meets our pelvis. It's a nice stabilizing exercise for that. Inhale, relax. Exhale and tighten. We're almost there. Almost through our first set. We got one more after this. Inhale, relax. Exhale and tighten, and squeezing the ball together here. Good. Make this last one a few extra seconds, because why not? Working hard. Good. All right, that was our first set. Take a breather. You can take the ball out or a pillow, whatever you got. Shake out your legs for a second. And then we'll do one more set of these. Good. How about I do this next set with the pillow instead of the ball, so you know what that looks like. I'm just taking a regular pillow, folding it in half. We're going to do the same thing. Inhale, relax. Exhale and tighten. And your belly should feel like it's lifting away from your thighs here. Inhale, relax. Exhale, squeeze the pillow. You're going to pop a balloon. Inhale, relax. Exhale, squeeze. This always reminds me of those Suzanne Summers Thigh Master contraptions. It's the same thing except using a pillow. Inhale, relax. Exhale and tighten. I think I still see some of those like being placed out on trash day. I'm coming to you from Philly, where we're all getting ready for the parade tomorrow. My office is in South Philly, very close to the stadiums and everything. So everything is being shut down tomorrow in the city. Schools are shut down. They're putting barricades on Broad Street. My office is 2 blocks from Broad Street, so there won't be any way to get here but walk tomorrow. I'm hoping you guys are Eagles fans, otherwise I'm sorry for the annoyance. Go birds. We got 3 more of this one. Inhale, relax. Exhale. Tighten your abs. Squeeze the ball of the pillow. Good. Almost there. Inhale, relax. Exhale, tighten and hold. Great. Inhale, relax. Last one. Exhale, tighten and hold. Let's make this one an extra long one. Let's do it for 10 seconds. I always like to finish every exercise set with a bang. Good. And then you can relax and shake out your legs. Tomorrow, it's totally normal to feel sore in your butt and your hips with these exercises. Yeah, that part of exercising, we get sore the next day, but that should subside in like 2 to 3 days, usually with some water intake. The next exercise we're going to do is a step up. If you don't have stairs at home or you're in a flat living setup, you can do a lunge instead, and I'll show you both versions. So let me just pull back my computer. And we're just going to do 10 of these for time purposes here. So I have a little step on the floor. I think everyone can see that. We're going to do 10 on each leg here. So you're going to start with a step. If you're doing it on the floor without a step, you're just going to put one foot in front of the other and hold on to something and lunge. But we'll do the step version, also very functional. We're going to start with tightening our pelvic floor, tightening our belly, and then exhaling as we step up. Of course, hold on if you have any balance issues at all. If you don't, try balancing. If you feel really safe and sturdy, the last thing I would want anyone to do is fall while doing their pelvic floor exercises. This is another one that could be irritating to folks with knee issues. So maybe just do the squat one, the mini squat instead of this one, and skip this one altogether if your knees bother you. And build your way up to this from squats. We got 3 more on this side, and then we'll switch. And I like to make sure you're breathing as you're stepping up. So exhaling as you're stepping up. Good. We're going to switch sides. Set yourself up. And instead, I'll show you the lunge version of this one on this side. So switch legs if you haven't already. I'm going to have my left leg out in front here. Right leg behind. I'm holding onto a table. If you feel like good about balance, you don't have to do that. So inhale down, exhale up here. So you're going to do the lunge version. Perfect. This is our last really hard exercise. So if you're getting tired, we don't have much left to go. Good, we got 3 more on this side. Inhale down. Exhale, tighten and squeeze your low abs. Last one. Good.